Today I'll be talking about the pathology of hip labral tears. The labrum, because of its function distributing weight-bearing forces, is susceptible to injuries from shearing or excessive forces at the hip joint. A labral tear results when part of the labrum separates or is pulled away from the socket. A hip labral tear may predispose you to develop articular cartilage degeneration and ultimately osteoarthritis in the hip joint. There are three main causes of a hip labral tear. The first is due to trauma or high-velocity injuries to the hip joint with or without hip dislocation, which can occur during car accidents or falling. The second cause of hip labral tear is due to structural abnormalities, such as hip dysplasia or femoroacetabular impingement, also known as FAI. Hip dysplasia results in decreased coverage of the femoral head anteriorly and laterally due to a shallow acetabular socket. This can lead to joint hypermobility and compression of the labrum, resulting in tears. FAI is a condition of abnormal contact between the femoral head and acetabulum due to anatomic abnormalities. The third and most common cause of hip labral tears are repetitive motions, typically sports-related, the sudden twisting or pivoting motions common in hockey and golf, extreme motions common in figure skating and ballet, and repetitive motions, common in long-distance running, can all lead to joint wear and tear that ultimately results in a hip labral tear. Tears of the acetabular labrum may be classified by location as anterior, posterior, or superior lateral. Anterior tears are more common in activities involving sudden twisting or pivoting, such as hockey, ballet, or golf. In contrast, posterior tears are more common in activities involving hyperflexion, such as martial arts, or squatting activities, such as horseback riding or cycling. Tears of the acetabulum have also been classified by type. Type 1, the most common, involves a radial flap tear with detachment of the free margin of the labrum from the articular cartilage that covers the bone. Type 2 is a chronic degenerative tear that appears as a radial fibrillation. Type 3 is a longitudinal tear at the junction of the labrum and acetabulum. Type 4 is a complex, abnormally mobile and unstable tear.